Welcome back, Dr. Linda here. Let's take a look at the skin. The skin is the integumentary system, part of the integumentary system. The skin, hair, and nails are really part of it. When we look at this picture, we can see that the skin is made up of this top layer called the epidermis, and then this deeper layer called the dermis. Now, under a microscope, the epidermis will have 5 layers. And on the next slide or two, I'll show you what those 5 layers of the epidermis are. The dermis only has 2. It has this upper part called the papillary layer, and then it has the deeper part called the reticular layer. Okay, so we have an epidermis, an upper layer, which is 5 microscopic layers. The dermis has only 2 microscopic layers, the papillary and reticular. And then the deepest part of the skin is called the subcutaneous, sometimes called the subq, also known as the hypodermis. Okay, a lot of injectables go right here into the subq, the hypodermis, right there because of the vasculature. All right, notice in the dermis, we have a lot of accessory structures here. We have some muscle, we've got some nerves, we have some glands, but let's take a look at the upper portion first. We also have the shaft of the hair here. So the epidermis has 5 layers, and if we look at them, right, here's the surface, here's the apical surface, the top part. We have the top layer called the stratum corneum. As we move down a layer, stratum lucidum. As we move down, granulosum, spinosum, and the germinatavum. Sometimes the germinatavum is sometimes called the stratum basal layer. Sometimes they call it the basal layer. So stratum corneum, if you look at this layer, it's like 25 to 30 layers of stratified squamous epithelium, right? So all this is epithelium, is stratified squamous epithelium. That's the stratum corneum. Then as you go down, stratum lucidum, granulosum, spinosum, germinatavum, all of the stem cells are going to be down here in the stratum germinatavum layer, as well as that basal layer. All of the stem cells are down here. And the stem cells are going to push and migrate upwards like that, till eventually they slough off, that you can see some of these cells sloughing off here. And it's about a 4-week journey. It takes about 4 weeks, unless you have like psoriasis or something, then the process is much, much accelerated. It could be 4 to 7 days as the cells slough off. Otherwise, about 4 weeks, and then the stratum corneum sloughs off. So how do you memorize these layers from superficial to deep? Silly little mnemonic. Cher loves getting skin Botox. Cher loves getting skin Botox. If you look at Cher, and that's not poking at Cher, Cher has been very outward about all the plastic surgery she's had over the years and Botox injections. I mean, it's impressive when you look at her, right? When you look at the face, but it's due to all the plastic surgery and all the Botox. So Cher loves getting skin Botox. And again, the Botox is for basal, but it's also known as the germinatavum. That's where the stem cells are. What else do we have down at the bottom? So after the epidermis, now down here, we're in the dermis. So these little mountains, these are called dermal papillae. These are dermal papillae. And these dermal papillae are involved in creating your fingerprint. They're involved in creating the unique fingerprint, those hills. Between the hills, though the valleys, these are the epidermal ridges. Okay, so when you look at this, again, it's like a drag and drop. Cher loves getting skin Botox. Those are the layers. And again, the upper portion is the epidermis, And you could see once you're past the basal layer, stratum basal, or the germinatavum, you're down in the dermis. And these would be the dermal papillae, here and here, and even here. Okay, but these basal cells, these are like, this is where your stem cells are, and then they're going to migrate and push upward. You want to protect these stem cells, and that's why you have all these keratinocytes. You're going to have melanocytes here that produce this black pigment. When UV rays come down, the melanocyte produces melanin, which acts as like this shield to protect your blood vessels, your DNA, your vitamins, all that stuff. Okay, so stratum just means layer, like stratosphere. So you got the stratum corneum, lucidum, lucid layer, it's clear, granulosum, lots of granules, spinosum looks spiny, and the stratum basal or germinatavum is that bottom layer. The only place we're going to have the stratum lucidum is where you have thicker skin. So the palms and the soles of the feet. Those are the only two places that you're going to have this layer. If it's not the palms or the sole, then you're not going to have the stratum lucidum. It just skips that layer and you go from corneum to granulosum. But the hands and the soles of the feet are going to have that lucid layer, that additional layer of protection. Okay. So up here, this top layer, best answer, epidermis. The highlighted area down below, dermis. The deepest layer at the bottom, hypodermis. Again, epidermis, dermis, hypodermis. Now, what do we have here in the dermal layer? We have muscle, right? The reason why the integumentary system is the first system we cover after doing the 4 different types of tissues is because the skin has all 4 types of tissues, right? It has epithelium, it's got connective tissue, right? You got blood vessels here. It's got muscle. You also have fat, which is connective tissue. You've got muscle, smooth muscle here. It's called the erector pili. It makes your hair stand on end, gives you the goosebumps. And you have nerve. You have these lamellated corpuscles, you have free nerve endings. That's how you can tell if someone's poking you or, tapping you with a sharp tack or touching you with a finger. Is it sharp touch? Is it dull touch? You've got these tactile corpuscles, you have lamellated corpuscles, known as Pacinian corpuscles, those for deep, deep pressure. The tactile corpuscles are more for like light touch, right? So because you have all 4 types of tissue, it makes it the perfect. And then you have look, you've got glands. You have your oil gland, sebaceous glands. These are oil glands. And then you have sudiferous glands, which are your sweat glands. So sweat glands produce perspiration, or sweat goes up the duct out through the pore, whereas the sebaceous gland produces oil. Oil is secreted, goes up the shaft of the hair, and produces this antibacterial watertight seal around the shaft of the hair. Now remember, the skin is not waterproof, it's just water resistant. It's not waterproof, it's water resistant because we can lose water throughout the day through perspiration, through breath, sweat. Okay, so, but the oils are antibacterial. So if you're constantly showering and washing and scrubbing and then putting, lubricants on your body, probably not the best. The body makes its own antibacterial stuff through the oils. Okay, let's see where we are here. So what is this layer where the tip of the arrow is? It's this here, which is 25 to 30 layers of stratified squamous. That's your stratum corneum. Then you have this highlighted area here, the yellow, share, loves, so that's stratum lucidum. And then Cher loves getting skin. What's all the way down at the bottom? Botox. So what do we have there? Botox, the B for basal. Cher loves getting skin Botox, stratum basal layer. Okay. These are the dermal papillae. So what's highlighted here? Those are the dermal papilla. Okay, finish up with nails. When you look at the nail, we have the free edge. We have the nail body. It should be pink. You have the lanula, and then you have the cuticle. Behind the cuticle is the nail root. The nail root is where you have behind it like the matrix. So if we look at the fingernail, finger from the side view, right? Here's the free edge of nail. Here's the nail body, the visible portion should look pink. If it's white, then you have anemic, you have anemia. Back here is the lanula, always paler in relationship to the nail body. Then you have the epontium, which is the cuticle back here. That's also stratum corneum. And then here is the nail root. Behind the nail root is the nail matrix. This is the epithelium that is proximal to the nail root, and it contains all the stem cells and the dividing cells that produce new nail cells. So here, this is all nail matrix, and it's going to push this forward, much like the skin from the basal layer pushed it up to the stratum corneum. You're going to have matrix that pushes the nail up to the free edge. Okay. So what's this portion here? The highlighted area, that's going to be the nail body. What's this portion right there? That's going to be the nail root. When we look at nails, it's part of the initial examination. Whenever I examine patients, you can pick up a lot of metabolic issues. When you start to see the nails rounding down like that, we call it clubbing. We see that with decreased oxygenation, typically with lung cancers, COPD, chronic obstructive pulmonary disease. We'll even see clubbing with celiac disease. We'll see it as well. So fingernails tell us a lot about the health of an individual. Here is a real individual. We can see the clubbing, and we'll see this as a result of poor oxygenation. We'll see it with cardiovascular issues. We'll see it with COPD, people with like emphysema. We could see it with irritable or inflammatory bowel diseases, and even with acquired immune deficiency with AIDS. So this is what normal looks like. And then when you have clubbing, this starts to round down, but this becomes very, very thick over here. That's the clubbing. Spooning looks like the shape of a spoon. We see that in severe diabetics. We can also see it with severe fungal infections. When you see the body not being pink, when it looks white like it is here, we're thinking primarily anemia. And anemia can come from an iron deficiency anemia. It can come from a B12 issue. Sometimes it can come from a copper issue as well. Okay, that's if it's more dietary. It can come from congestive heart failure, liver issues, and malnutrition. If the nail is white, I like to look at the tongue, and then I like to pull the eyelid down and make sure that the inner part of the eyelid is pink and not white. And of course, you ask, how's your energy level? Are you fatigued? Are you tired? Those type of things. Here, we're going to be talking about skin cancer. This was one of my patients, and they had this structure here called the subungual melanoma. When you talk about skin cancer just doesn't affect the skin, but it can affect the nail as well. So, whenever you inspect patients and you look at them, I always shake their hands, I turn it over, and I look at the color, I look at the shape, and you could pick up a lot of different types of diseases. Here, it looks like a candle wax dripping type of appearance. This could be seen with certain endocrine issues like thyroid disorders or Addison's disease. These are more endocrine based. You could see them sometimes with B vitamin deficiencies and just general hormonal changes and with chronic stress, right? But they're not normal. We have to say, okay, what's causing this? What's causing this type of appearance?